Thank you, Dr. Kohler and the St. Luke's Committee for asking me to speak. My speech starts off a little sad, but I promise a happy ending. One day last year around this time, my father called me multiple times complaining of really bad heartburn. He had an appointment with our family doctor later on that day, so naturally I said, talk with the doctor. By the third phone call, I again said, Dad, seriously, talk with the doctor, cool it with the coffee, take some Tums. I wasn't really listening to him. During the fourth phone call, he suddenly went silent on the phone, but I could still hear him breathing. I realized maybe 2 to 3 hours too late that my dad was having symptoms of a heart attack. I gently told him to breathe and not worry, and with another phone, I dialed 911. He made it to the hospital safely, and the top of the differential was rule out acute coronary syndrome. Dad told the hospital staff that his oldest daughter, a Loyola medical student, is coming soon and will be helping him make the medical decisions. The staff was overzealous in letting me participate in my father's care, I thought, because as soon as I arrived, they took me back to the angio suite and showed me his diagnostic angiogram. As I'm sitting with the cardiology fellow, I saw the dangerous perfusion defects through 3 vessels supplying my dad's heart. If that wasn't overwhelming enough, it was then explained that I had to help my father make the difficult decision between 2 treatment plans. One being angioplasty, commonly known as stenting, and the other a coronary artery bypass graft procedure, a CABG, which involves cracking the chest open and having the patient on a heart-lung machine throughout the entire surgery. It was scary. While the fellow was explaining his assessment and plan to me, like I've done hundreds of times to my patients in the last 1.5 years, like we've all done with our patients, I became a complete mess. And within seconds, the fellow was handing me tissues and trying to comfort my tears. I wanted to share this story because this personal experience taught me, in a harsh way where I wasn't even the patient, let alone a patient without medical training, of vulnerability, of a patient feeling vulnerable in the face of shocking news. I felt that whatever I knew about heart attacks, the pharmacotherapy, the EKG findings, etc., became a blur, and I wholeheartedly depended on the cardiologist and the cardiothoracic surgeon to know. The doctors know what to do. My doctor knows what to do. That relationship, the sick patient and the treating doctor, is a very powerful reality that bears a huge, oftentimes daunting responsibility. But this relationship is also an enormous privilege because we can be the source of relief to sometimes complete strangers in the scariest times of their life. I wanted to remind my peers of this responsibility, especially to my amazing classmates, the M4s, who will be interns very soon, and who will feel the weight of that responsibility as patients and the nursing staff address them as doctor for the first time. I want to encourage my younger colleagues, the M1s and M2s, whose classwork can be overwhelming and exhaustive, that you are working hard because one day a patient is going to depend on you to know. Don't worry, M3s, I didn't forget about you. This speech is especially directed towards your class because this is the first time you're interacting with patients on a daily basis. You threw your mounds of books and flashcards on the bookshelf, put on your white coats and stethoscope, and came running to the floors. I remember that excitement, that magic. Your primary concerns are writing a good note, getting along with the team, giving a good patient presentation, and teaching about an article you read. You are interacting with a multitude of personalities and meeting an immensely diverse patient population. It might be your first interaction with asthma or a sore throat, or your first interaction with cancer, an amputation, or a colostomy bag, or your first interaction with alcoholism, drug addiction, or child abuse. When your time becomes precious, like around 6 p.m. when sign out is at 7 p.m., and you've been at the hospital since 5 in the morning, and you still have to go home and study, you may find yourself in the position where you start liking or disliking your patients, or where you judge a clinical scenario as worthy of your efforts. For instance, you may want to take care of a cancer patient having a bad reaction to chemotherapy instead of doing hourly withdrawal checks on an alcoholic patient. This is where this year's theme of Be the Change You Wish to See in the World comes in. When I was asked what change do I wish to see in the world, I thought, I wish we can change the way we see the world. I know Gandhi would have been irritated that I changed around his quote. I'm just kidding, Gandhi doesn't get mad. But honestly, I wish we can challenge ourselves to remember that the patient is a human being who has made decisions and choices in the context of their life, a life that we have not lived, and that led them to the point where they are now. I wish we can take a step back and allow the patient to be who they are and offer our best medical advice at face value. And finally, I wish we can remember that in sickness, the patient is most vulnerable and trusts you in their moments of uncertainty and fear. Because in truth, a patient's life, a person's life, is their world. And if I can think of one change I'd like to see is that we listen better to the human beings who are depending on us. These are not unrealistic wishes, especially to Loyola trained doctors, where we are reminded constantly through our patient-centered medicine courses, chaplain shadowing, patient reflections, medical mission trips, and research projects about the human side of medicine. Even further, we can look to St. Luke, the patron of today's celebration, who is commonly known for 3 roles in the Holy Bible: the physician, the historian, and the artist. From day one of our patient-centered medicine course, we learned that 96% or so of diagnoses can be made by taking a good history, by listening to the patient, hearing their complaint, and understanding their symptoms. St. Luke was born in a city called Antioch in ancient Syria, a city that served as the home base of the Antiochian Orthodox Church, a faith that my family and I practice. Icons depicting the saints and the life of Jesus Christ serve as a large expression of our faith. So this past Sunday at church, I looked for St. Luke's icon. I noticed that his icon and all the other icons in the church have very similar animated features, such as big eyes, small mouth, and large ears. And even some icons have the face turned where the large ear is in the center of the icon. This is intentional, of course. Big eyes are to focus on God, and big ears are to hear God's teachings. And the small mouth, well, that's self-explanatory. Remember when I said St. Luke is known as an artist? In the Orthodox faith, he's actually known as the father of Christian iconography. So let's take St. Luke's artistic formula of big eyes and big ears to our practice as physicians and look and listen to our patients. If we do this, we'll be good historians and get the right diagnosis almost 100% of the time. With that change, we can make someone's world better. This is something worth celebrating. So I promised a happy ending. With the advice of his physicians, Dad opted for angioplasty, and 13 months later, he's currently and consistently smoke-free, red meat-free, and caffeine-free. Thank you very much.
Thank you, Dr. Kohler. As he said, my name is, sorry, it's a little more full than I expected. My name is Jim Grace, and I hate to be the person standing between you and lunch, so bear with me a moment, and we'll get out of here. I believe it's kind of hard to know where we're going without talking about where we've been. So about me, in addition to enjoying long walks on the beach and stargazing, I have spent a great deal of time and energy trying to help others. My quest in the name of service has taken me around the world and led me back home again. Let's take a step back. The first question you're probably wanting to ask me is why? Why am I standing up here? Why does a middle-class male from the Midwest who has attended private schools all his life, who at Notre Dame spent more time in the football stadium or in the research lab than looking at the plight of others, decide that he wants to live for them? Well, a critical moment for me came in the fall of 2006. I was deciding on my vocation between medicine, teaching, maybe in the ministry. There was a symposium on global health at Notre Dame where Doctors Paul Farmer, Jeffrey Sachs, and Miriam Opwanya were invited to speak. Here were 3 examples of people living for others. Now, knowing what you know about me, or don't for some of you, who do you think caught my attention the most? Was it Dr. Sachs, the world-renowned economist, who, clearly that's not a no, but who proposed an end to poverty? Not quite. What about Dr. Farmer, world-renowned medic, anthropologist? Not quite. He's all right, I guess. I mean, he will be getting the Sword of Loyola this year. But I kid, I greatly respect Dr. Farmer for his work and his dedication. But it was the hospital doctor, Dr. Opwanya, doctor without a foundation behind her name, who chronicled her experiences in rural Uganda that provided the most inspiration. She cut through the lofty ideals of the symposium to the heart of the problem. And one line has stuck with me from that day going forward. People helping people. That's the way to change the world. Since graduating Notre Dame in 2007, I have made service a driving force in my life. I found satisfaction in giving myself and my gifts to others. After Notre Dame, I spent almost 2 years at the Amigos de Jesus orphanage, serving more than 60 disadvantaged boys as mentor, teacher, chauffeur, nurse, and friend. The joy I found in Honduras led me to volunteer full-time at a free clinic in South Bend. And from there, the traditions of service and education, the ideals of cura personalis and being men and women for others, led me here to Stritch. Service has carried me through long nights of studying in my first and second year, kept me sane as I embraced the vibrancy of the children at St. Eulalia's Soup Kitchen after a day in the cadaver lab, and gave me something to look forward to as I prepped for both ISI and finals at the end of my first year. I learned quickly that if I was to succeed in the classroom, I had to find a way to thrive outside of it. Now, as students, we all have things we look forward to outside of school and work, whether it's a Notre Dame football game, the next season of Game of Thrones, the new Hobbit movie, Christmas. Maybe those are just things I look forward to. But I urge you to include something that is outside of yourself in this differential of things to do. A good friend of mine, who some of you know, graduated college with a degree in English and a ambition to drink coffee and talk about Russian literature till the wee hours of the morning. He spent a year at an orphanage, returned a year later, decided that he wanted to focus on medical school, that suddenly drinking coffee wasn't good enough. Well, you're gonna drink a lot of coffee in medical school. But this is an example of what service can do for you. It can give direction, motivation, and affirmation along this timely and winding path from medical school, through residency, and on to serving on our own. Medicine itself is a service to others. We meet perfect strangers at their most vulnerable moment. We ask them to share their burden with us, and if possible, we try to point them in a direction of a solution. We ask them to trust us, that we know what we're doing, that if this current direction is not the right one, we won't abandon them. We'll come back, reassess, and walk with them a little further. It was in my third year that I truly realized this. Third year is a strange beast. I hope the third years in the audience aren't offended, but it's centered on acting like a doctor, trying to walk the walk. So we get to participate in all parts of care, from taking the history, performing a physical, reporting the lab results, trying to read about what's going on, establishing a plan, and communicating that plan. But third year is a shift. It's a change in focus. The first 2 years of medical school is all about you. I remember Dr. Herring telling me that the greatest advice, the greatest service for my patients was studying hard now, that I had to know it in my heart. Right, Dr. Herring? But he was right. You know, it's difficult focusing on bettering yourself when, as a doctor, it's hardly ever going to be about you. Third year was incredibly educational, but also for me the most difficult year. We were shuffled around like a deck of cards. We don't get to see the fruits of our labor other than a score on an exam. We work hard for our patients, but often we miss that post-op follow-up or the next clinic visit. These are the people we invest in, and we don't often get to see how the story ends. But I think there's hope. Recently, I ran into a patient's family at Starbucks. I was there studying for step 2, aka checking Facebook every 30 seconds, making sure that during that question on obsessive compulsive disorder that nothing had changed. When a family approached me for my medicine rotation, I was their medical student. We sat and chatted for a while about how their mother was doing. They raved about the doctors and nurses and how they saved the day. I was sitting there trying really hard to be humble, hoping they'll mention the medical student and how awesome he was. Maybe they knew all the papers I had read on pulmonary hypertension. Maybe they know about the hours I did put in trying to learn that new treatment and be able to explain it on rounds the next day. Maybe they saw the spark of a doctor in me, just waiting to be ignited. Maybe the time I sat and explained the plan for the umpteenth time finally sunk in. But at the end of the conversation, they got up and said to me, "Thank you for being there." That was it. Nothing. Not even "I'm sure you'll be a great doctor someday." That's what I was to them. I was there. Soon after, I came across a quote. "People will forget what you said. People will forget what you did. But people will never forget how you made them feel." And that was it. This family appreciated that I was there. This, to me, is the definition of our service as medical students. It's in giving of ourselves and our time, hopefully making that patient feel less alone, maybe listened to. Maybe it was just the fact that someone was smiling at 6 a.m. when their world was about to fall apart. As medical students, our time is pretty valuable. I mean, we pay a good amount of money to be here. Has anyone done that calculation, figuring that out? Don't want to scare you, but we pay about $20 an hour to be here. So in the time of this talk, just think about that. But, service to the patients is not the job. It doesn't carry a monetary value. Service is the way we do our job. It's the way we give value to our time. During medical school, I spent a month in Honduras, a month in Bolivia, and a month in Peru. I've worked at free clinics, and what keeps me traveling to these countries and going back to those clinics is the value of the time. When you're living for someone else, be it a friend, a loved one, a complete stranger, something outside of you, your time has more meaning. That's what kept me, and a chronic alarm oversleeper, from only missing his alarm once in the last year. I'm pretty proud of that. This past July, I was fortunate enough to spend the month in the middle of the Amazon, working at the Centro de Salud in Santa Clotilde, Peru. I worked closely with Father Jack McCarthy, a Norbertine priest who trained here at Loyola, at this mixture of a hospital, clinic, OR suite, and birthing center. One of the first things Father Jack said to me as I got there, he said, "I hope you didn't come here to sleep." On the Amazon, the health needs were great and many. Frequently, I was roused in the middle of the night to calls of, "Doctorcito," little doctor. I feel that was fitting. For an emergency C-section or surgery, a worsening fever, or an urgent patient who had just arrived on their boat from upriver. When the needs are great, it's easy to feel like your time is worth something. And my time there was in demand, whether the hospital, the clinic, there were patients to see, and they came to you because you were their option. I remember my first night of call, being woken because a patient was vomiting. The nurse asked me what I wanted to do. I had to stop for a second. What did I want to do? I wanted to go back to bed. But I had to stop and think a little more. Didn't they understand that medical students, we don't make decisions? We just say, "Hey, this sounds like it could be a good idea." But at that moment, at midnight, something had to give. A change and a charge had to be made. Being a passive medical student, like drinking coffee and discussing literature, suddenly isn't good enough. It was a call to service. Armed with this confidence, I attacked each day. It wasn't without mistakes, as a patient on my watch received 5 times the amount of anti-malarial medication he should have, leading to days of protracted vomiting. I felt terrible. But you remember those mistakes. I hope that many of you get the chance to travel to Peru, to be part of that community, meet the needs of the people there. I would call it the most formative rotation I've had in medical school. It's where I put all the pieces together. Finally felt like I might make it as a doctor one day. And Loyola helped me get to this point. I don't know if it's the mountain of reflection papers I went through, trying to find the words for today, or the way that we're taught to be men and women for others. And the faculty I've encountered along the way have shown me that service is a way of life. Let's be clear. As Dr. Simpson would say, it's a little more than just service between friends. When your internal medicine program director is also the advisor to this community health clinic board, in addition to running the intensive care unit. When your medicine clerkship director not only runs the hospital, but the free clinic as well. when you're head of your family medicine program, provides breakfast for the whole third-year class. And your nephrology lecturer has given her own kidney away and started a free clinic on the other side of the world. One thing Sister Brenda and I discussed when I was considering speaking today, and by considering I mean she asked me and you can't say no. We talked about be the change you wish to see in the world. This golden rule speaks loudly to those who would listen, but sometimes the examples we have been given speak more loudly than those words. So what does that mean for us students? We know that change is not convenient. Honestly, medical school is not convenient. We've all had to tell friends that we'll catch up with them next time. We've all had that test on the Monday after Super Bowl Sunday. First years, get ready. You know, we've all had to be at the hospital by 6 a.m. the next day. We've had to tell our friends, hey, it's not you, it's me. I took 3 years off before medical school because I wanted to have an active hand in the person I would become. I can still remember my dad saying, wouldn't it be easier to get a job and just make money? Yeah, Dad, that would have been easier. But service in medical school changes you. It changes your outlook. It teaches you to look outside yourself, to see and serve a patient. It teaches you that when you spend time in the service of others, your time has a little more value. And I think these lessons are worth all that we've sacrificed. It has led me to believe that service is a way of life, and I encourage you to do the same. And remember that people helping people, and that's the only way to change the world. So thank you, and buen provecho.